Okay, so to all of you who are joining this session for the first time, we will keep the format same like our all previous webinars. So first, Dr. Geeteshwar, he is a psychiatry SR. So he will cover all about the challenges you have shared in the form while you are filling. So we have compiled all the problems raised by all of you. So he will first talk about how you should take care of yourself and understand the challenges you are going through. And once he will cover, Karthik will help you understand, because just few months down the line, Karthik was at your space and how beautifully he is able to handle the situation. So he will help you with the real. Riddhi is also here. So they both will help you how they can handle the situation, and then you can unmute yourself and ask your question. And even if you have any questions, just feel free to drop it in the text box. We'll pick it up later. So over to you, Geeteshwar. You can start. I will just keep the concerns here shared.
Thank you, Astha. Thank you so much for the introduction as well. So, hello everyone. My name is Dr. Geeteshwar Diwan, and till a few days back, not actually a few days back, till yesterday only, I would call myself a psychiatry resident. But now I am through with the residency as well, and after nine plus years of medical training through undergraduation and post graduation, I can now say finally that I am at that stage where officially I can help you out with understanding yourself, with understanding how the processes of the mind work, and how to actually resolve anything that comes through that journey. So, first things first, we need to understand that any healthcare issue, especially in the population of medical healthcare workers, it's very, very prevalent. And not just because of the kind of work we do, but also, and in fact, primarily because of the kind of studies we have to undergo, the kind of competition that we have to undergo throughout the process. And it's estimated that the mental health burden is approximately 30 to 40% in that particular population. But today I'm going to talk about the various aspects of stress, the various aspects of mental health related issues that we come to experience through our journeys, and some basic tricks, some basic tips, some basic cognitive restructuring which we can do at our individual level, and how to actually go about all those problems. What is the threshold where we have to take a call that, okay, now I need some professional help? So we're going to cover all of that in brief because we can't go in a lot of detail, but we definitely can cover all the main important points. And as Astha shared, any doubt which you have, you can put across the chat and we can discuss about it later. So first of all, we need to understand that not all kinds of stress is bad. I'm starting with this because it is very important to evaluate that the stress which I am experiencing is also the stress which helps me to actually push through the battle of preparation, to push through the battle of study. So when that stress is under adaptive limits, it means that when that stress is helping me, it is known as U stress. That is EUSTRESS, U stress. So that U stress is actually good. If I have an exam tomorrow, I need to have some stress, and that is a good stress. But when that stress goes above a certain threshold, it becomes distress. And primarily, that distress hampers our productivity because not only does that distress makes us feel jittery, anxious, but it can lead to a level where it can develop into a full-blown illness. So we need to work to identify when that stress turns into distress for us. Eustress is good, distress is bad. The other thing is that stress works in a continuum. Initially, the kind of anxiety which we feel going across our books, preparing for an exam, thinking about an exam, thinking about the preparation, thinking about the competition, that is an adaptive alertness that makes us alert and agile towards the challenge which we may come to experience. But eventually, that at a persistent level can lead to burnout and anxiety and depressive symptoms and so forth and so on. So again, it's the same thing. Whether if we find ourselves to be on the difficult end of the spectrum, or we find ourselves to be in a zone where we are immensely distressed, it is an alarm, right? So what can be the sources of frustration? For some, it might be academic, might be the kind of syllabus, might be, lack of rest, which is very important for our brain and our physical health. For some, it might be performance related anxieties. I'm not getting the kind of rank I want in the tests. For some, it can be some personal factors, relationship problems, uncertain future. And for some, it might be systematic. That is, lack of a structured guidance, lack of somebody who can help you throughout the problem which you are facing. So all of these can be various different sources of pressure. Now we need to understand that there are two kinds of situations. One situation is where you have entered the zone of distress. You're full of tension. You're probably because of your marks, probably because of the competition, probably because of not being able to cope up, can be anything. And at that particular point of time, you can navigate through the problem yourself. It has reached to a level where you know you have identified that, okay, there is a problem, but it is at a very initial level. I am recognizing that something about me is changing. My mood has changed. I'm a little irritable now. I'm becoming sad now, and it's a continuous thing now. It's not just ki एक दिन दुखी था या 2 दिन परेशान था. Now through weeks and weeks, I'm sulking, I'm sad, I'm irritable, right? My sleep is getting experienced. My sleep is getting changed. The number of hours that I'm sleeping has become less. I'm waking up more and more at night. So sleep related issues can be there. I'm not taking care of myself. I'm not eating enough, or I'm eating too much. Both ends of the spectrum, right? My body, it feels powerless. I feel no energy in my body. It's easy fatigability. Or it can be simply that I try to study, but I'm not able to focus. My concentration is lacking now. And that is actually where it starts. Whatever I have mentioned in the last 1 minute, that is actually where it starts. We, most of the times as medicos, we are so attuned to just doing the same thing every day that we feel, okay, ye to theek ho jayega. This is a phase. And okay, maybe sometimes it's a phase, but sometimes it persists. Ek hafta, do hafta, maybe 3 weeks, 4 weeks, and we just let it be. That is where we have to identify, okay, it's going in the wrong direction. I need to identify it. I need to work on it. I need to work on my health. I need some guidance, right? And then if it crosses that level also, then it becomes a full blown illness, because then depression will come, negative thoughts will come, and hopelessness, helplessness, maybe suicidal thoughts, maybe anxiety. So we have to curb the evil in the bud. We have to control it as soon as we identify it, and then we have to start working on it, right? So if it is at an initial level where you have identified that certain problems are setting in, then there are certain things which you can do at your personal level at the initial stage, which can or which may help you to actually curb it completely, or maybe to give you enough time to deal with the situation till the time the stressor which is acting upon you, it gets eliminated, right? So first thing is that you need to understand that it's very important to have a structure to your day. A lot of times when we're preparing for exams, especially when we're not working along with, or we don't have a structured routine, it gets too monotonous. And we have a fear of missing out, the reverse fear of missing out. If I'm not studying, then I'm doing something bad, so I have to have the book with me all the time. I have to study all the time. Oh my god, how did I afford this half an hour of chit chat with my parents or with my friends? Oh my god, I have to go and have the book with me. And that anxiety that keeps us from having a structured routine, from taking rest. This has happened with me also. I can totally relate with every problem which you have, because this is all what I have been through, right? Everybody gets through that phase. And this is maladaptive. This is not right. This will definitely lead to something which will trouble you. So structure does not necessarily mean what is the time to study and what is the time to not study. It means what is the time to study. It means what is the time to rest. It means what is the time to actually have a physical activity for yourself. It's very important to get the mind working. Having maybe, walk outside in the nature. Maybe for somebody, it may be going to the gym. Maybe for somebody, it is like playing, 30 minutes of some sport. But it is very important to have that structure to your day. That is a very, very important thing if you're experiencing any problem. Then that structure should also include things which you like, some hobbies, or maybe talking to friend. So that structure will guide you towards having a more proper fulfillment of the day. So even if you're studying for, let's say, 9 or 8 or 7 or 6 hours, those 6 hours will have a much more quality time for yourself, right? So after this structure, we'll move on to the next thing, which is controlling your autonomic nervous system. We all are doctors or budding specialists. We all understand how the autonomic nervous system works. When we have a control on our breathing, we have a control on our mind. And breathing exercises are actually, taught in various forms. For somebody, it might be pranayama. For somebody, it might be yoga. है ना? So this breathing is actually it's the key to your brain. So if you're feeling overwhelmed or if you're feeling anxious, okay, you might not know what to do in yoga or a pranayama, but today I can actually tell you something which is very easy, which you can do, and that will help you to calm down. So if you are feeling overwhelmed or if you are feeling burdened, you just need to take some time off. You need to sit in solace, you need to close your eyes, and you need to do something which is known as a box breathing technique, wherein you work on your breath like a box. How does a box work? It's a square, right? So for the first 5 seconds in that square, maybe that's one line which goes upwards, you take a deep breathe in. So that needs to be, okay, maybe 5 seconds, maybe 6 seconds, maybe 4 seconds, as long as you're comfortable. But it has to be a deep, deep, deep breath. And a deep breath means that you should feel your stomach actually popping out, the diaphragm going down. It has to be a deep breath. After that deep breath, again, maybe 5 seconds of holding that breath inside. You don't need to exhale it immediately. You have to hold it. And then after that 5 seconds of holding the breath comes 5 seconds of exhalation. So that works like a box, and then 5 seconds of nothing. And then you start again. So this box breathing technique, it has a scientific evidence to it when it is done continuously at that very point of time when you are under immense stress or probably overwhelmed, and you can do it for 2, 3, 4, 5 minutes. It helps you to calm down the sympathetic activity, the parasympathetic activity. It brings the sympathetic activity down, and eventually it gets balanced to a level where you can rationally think about the situation, and that feeling of overwhelm actually goes down. You feel cool and calm at that point of time. So this is a very easy hack which you can employ to your day-to-day life. Then moving forward, a lot of people complain that when they're studying or when they're preparing or discussing, a lot of negative thoughts would come across. मुझसे नहीं हो पाएगा. I did not get good marks in this test, means I'm a failure. All of these statements which crop up in our mind, we have to understand that these are known as negative automatic thoughts. This terminology is negative automatic thoughts. These are automatic thoughts which generate in our mind while we come across neutral situations. But the caveat is they are negative. They are not positive. Oh my God, I'm going to talk. Or oh my God, everything is going to be well. They are negative. And they are persistently negative. And they will span across everything which I am doing. And we have to understand that these negative automatic thoughts are actually arising from something which is deep inside the mind, which are our cognitive distortions. Cognitive distortion is a little heavy word. If I want to explain it to you in a simpler way, it's basically that we have made an image for ourselves because we find ourselves stuck in a particular situation. We have made an image of ourselves in our brain and we identify ourselves with that particular image. That image may be I'm not good enough, or I'm a failure, maybe any negative sentiment which has become the core of our belief. And now because we have come to that point that core belief has set into our mind, everything which we are doing is triggering a negative automatic thought inside me. So even if I got one MCQ wrong, I will immediately close my computer, my laptop, my tab, whatever I'm using the device I'm using to do those MCQs on, and I will just think to myself, I'm a failure. How did I get it wrong? I'm a total fool. I'm a total failure. After studying 20 times, I'm still getting it wrong. So those are actually cognitive distortions which are pushing those negative automatic thoughts into your mind again and again and again. And you don't need to actually believe them all the time. You need to double guess your own self. That is known as cognitive restructuring. In actually, that is the core principle of cognitive behavioral therapy. That's a separate thing altogether. But to understand it, that जो मैं सोच रहा हूँ जरूरी नहीं है that at all points of time that is absolutely right. We have to wait and evaluate that, okay, I might be thinking too harsh about my own self. Just because I got a few wrong, or just because somebody told me that, oh my God, I am not as intelligent as them, or somebody commented negatively to me, that means that it is an absolute reality, right? So that double guessing is, you need to double guess your own self. It is an essential element to actually improve your own cognitive process, so that you don't end up in a situation where it gets beyond the point where you can help it any longer. So that cognitive restructuring is equally important. Then another thing which I have briefly talked about while I talked about structuring your day is actually improving and working upon your sleep and your circadian rhythm. So circadian rhythm is considered to be, we all are medicos, we understand what is circadian rhythm, but a basic principle of the circadian rhythm is that we have a pineal gland, right? It's right behind the glabella, and that pineal gland would secrete melatonin. That melatonin is actually something which would trigger the sleep reaction at night, and a 24-hour sleep cycle would set in. Now the problem is that because our sleep cycle might be erratic, or we are studying late at night, or we are not just sleeping enough, eventually those circadian rhythms, they get affected. And as soon as the circadian rhythms get affected, all the neurotransmitter shift will start happening in the mind, and that will lead to something which may further your chances of developing a mental illness altogether. So sleep and circadian rhythm readjustment is extremely important. So these were some basics which you can actually employ in your day-to-day life, and these are very generalized because everybody might be facing a different kind of a situation. But all of these things, if done together, can curb out a lot of difficult situations which you are going through. However, we must also talk about the other end of the spectrum here. So not every time that maladaptive stress or distress, which I talked about, is something which is manageable by a person themselves. A lot of times that problem needs professional involvement, professional help. So if you feel that it has come to a level where your mood, your sleep, your appetite, your self-care, your day-to-day activities have changed, where you have a feeling that I'm not able to help myself any longer, despite making n number of changes in my lifestyle, in my thinking process, now it is beyond me. It definitely means that you need to step up and you need to help your own self. Day in and day out, we are treating other people, we are treating patients, we are being compassionate. But it is also important and extremely important to be compassionate to your own self. So if you feel that despite everything, I have crossed that line where I can help my own self, you need to put your hand up and you need to seek professional help there and then. And definitely, as medicos, we understand better that seeking help is not a sign of weakness at all. It is a sign of identifying the problem and curbing it before it happens. So with this, I would like to wind up my session because I don't want to make it long and boring. I think I've covered all the basic things. Rest you can share on the chat. Thank you.
Thank you, Giteshwar, for covering all the important component. We'll keep it this way. That first, Riddhi will share her experience so far and what the message she has for all of you, and then Karthik, and then you all can unmute and ask. Riddhi?
Hi,
Yeah,
am I audible?
yes, you are.
I'm so sorry for the background noise if there's any. Uh,
She's in Diwali party. The exam is over, and now they are doing Diwali party.
thank you so much, Giteshwar sir. I really resonated with few points he said, like the study anxiety which you said. Now that even after the paper is done, I am having that anxiety, the guilt that how am I so free? Like it's the first time in last 6, 7, 8 years when I am not studying at Diwali. So I have that guilt that why I'm not studying. Uh, so my journey is, I guess, it's like through the podcast, if anyone would have heard. So I had a lot of fear of failure, and when I could not get into the rank, like I could not get into Maulana Azad or any Delhi college for that matter, and I had to go to Jhansi. That is when my full blown depression came first episode. Then it was recurrent depressive disorder. I had generalized anxiety and CPTSD as well. And not many people know it actually. I was even admitted to IBHAS. Like voluntarily, I had to go and get myself admitted in third year. I have high functioning, so no one actually knew, but the suicidal ideations and the pain, I don't have words to describe the pain I have been through. And at that point of time, and even during my entire preparation, at one point of time, I started to blame my mental health. Like, people don't, those who don't have anxiety, they do much better. They don't have this fear of failure. I always had that constant fear of failure. And in INI, like, it was my fear come true. Like, I had a rank of 9K in UG, and in INI, when the competence, like, it was just 1 lakh. I got a rank of 11K. So it was really shattering. It was like whatever I had practiced and all my psychiatrists and therapists, it felt like I have failed everyone. So it was bad. But then somehow I just knew that I have to attempt and go for NEET PG. So this time I got a rank of 5,000. And I feel like I know all the feelings. I know all the feelings that an aspirant goes through, and the self-esteem and the academic validation, and how you attach everything to your, like, you make academics your identity, but it's not that. So, yeah, I mean, if my journey can help anyone out, I hope it does. So, yeah, now I guess Karthik can take on.
Karthik, you are on mute.
Yeah. Am I audible?
Yes, you are.
Yeah. So, like, whatever Sir told, it was really like beneficial. Even I like tried a lot of things out of that in like my day-to-day practice. So, if I have to like describe my journey, thoda sa short mein, to fir it was like all very chill. I've been like sort of a topper sort of a person throughout my school. So I already carry that pressure on me since school that I have to perform really well. So when I joined my UG, my first year was all cool. Then there was a lot sort of introduction and everything is involved in medical colleges. So the thing was, the problem I had was to adapt in a particular environment. So I'm not someone who like chill or vibe with anyone like very quickly or something. So by the time I got comfortable in the college, already the groups were formed. Then I never like found a corner for myself to like place myself somewhere. So I was sort of lonely since my first year. Then in second year, it got aggravated. Like in my head, it was a lot. I used to skip my classes. I remember for like 4 consecutive days, I was just locked in my room. No one knew where I was. I was just talking to my parents. That's all. I did not go for like mess or anything. So yeah, and then I started like there were a few other things involved. So all in all, I considered myself as the center of this despair. So I started self-hating myself a lot, through which I developed some self-destructive behaviors. After which I felt that I should be seeking help. So I'm also a poet. So I used to be in touch with a lot of people who are related to poetry and stuff, and like depression and poetry comes like quite naturally. So it was like, yeah, so they also suggested me that I should be seeking some sort of help. So I was like not very much literate about it, I'd say, because I don't honestly come from a background where we have a lot of knowledge about it, like every other Indian household. So I could not tell to my parents. I went to a psychiatrist in my own hospital in my college. Uske baad, things started like becoming a bit better. It took a lot of time. That behavior continued for a long time. Usi beech mein I like met through a friend of mine. I met a therapist. Like she was working in Dubai, so we used to have like online sessions, and I guess that's what something that changed everything. I mean, the medication honestly was not that much effective, but after taking the therapy sessions and everything, it got like way better. Uske baad during third year, I started my own coping mechanisms. I used to write aggressively. Uske baad, I also used to solo travel a lot. I've traveled a lot in my third year. My studies got better. I like I you matlab aisa nahi tha ki I'm just focusing upon studies. There were a lot of other domains of my life as well, just I was focusing on, and things got better. But like when this plus like I also came out to my friends. Like my friends were like very very supportive about mental health and everything. They, yeah, they totally supported me about it. Uske baad things got better. Uske baad this prep phase started. So as I told, like I never like compromised upon my studies. That was one thing. Agar main kuch bhi kar raha hu, I need to like take out that much time in the day jitna I have to give to studies. So during internship, it got a bit hectic, I'd say, because I used to force myself a lot. Suppose agar medicine ki 12 hour ki duty, I'll force myself ki I have to study like for 5-6 hours. Otherwise, I'll fail. This and that will happen. I'm a failure. This, all of this. Things started happening. Plus, like, I don't know, like in government hospitals, psychiatrists वगैरह बहुत जल्दी जल्दी change होता है. So जो मेरा rhythm था एक psychiatrist के साथ, that was totally broken, and it's very very difficult to like open up all over again to someone else. So I like altogether stopped like talking to them since my final year. उसके बाद, yes, my internship was hectic. I was not on any sort of medication, which was also a good thing. But yeah, it took sort of a toll on me because I compromised upon my sleep. I compromised about my mental health and everything. And I landed up with a rank of 9,000 in my first attempt, which was during my internship, which I used to feel was very bad because I had very high expectations from myself, honestly. But like by the end of the counseling process, I eventually started realizing that it is not that bad of a rank. A lot of people do aspire for it, and I did like I did the hard work. That's why I got something. But I eventually dropped off the seat. Then my drop attempt was pretty much chill. I was at home. I was not stressing a lot. I used to go to gym. I used to like do gardening. I opted some hobby. And I used to give barely like 6 or 7 hours, unlike my internship, in which I used to give like entire day just for the preparation. And like thankfully things turned out well, and this time I got a rank of 765. So yeah, that's all that was from my side. And if someone resonate with this, it, I mean, I hope that it would have been helpful for someone else. Yeah, that's all.
So, so for all of you, the story which Karthik and Riddhi has shared, it's very far-fetched. Like they have been in this period of depression, they have understood it, take the counseling, but everybody is not in that state. Because you might be in that stage that the anxiety and pressure is building up on you, and you might, there's very easier way to tackle it. It just need couple of right discipline, the way Geeteshwar has already mentioned. But if any of you are feeling that this need help, just take the right help, because just avoiding the situation and going with the stigma that we don't need a help, that will not going to help you anyway in the future. So and so all towards, if we can cover more, then we will open the questions more up towards the one who is just going through exam pressure, because there's so many concern raised that NEET PG anxiety, medicine loan, yeah, radiology loan. There's a lot of career confusion, and that causes a lot of pressure because medicine in general is a very competitive field. Very limited seats, lot of competition, very longer study period, lot of career confusion, loneliness, and whatnot. And it's very demanding field, and that per se comes with a lot of mental health toll. So how to take care of our own self during that period, if we can just talk on that ground. That's for generic for everyone should come back home with that. Giteshwar, Karthik, or like any one of you, if you can start, we can talk about this point.
Yes, Asta, definitely I would like to add on that since we have time also to actually talk about it. I have lots to share, but I actually restricted myself so that others can have enough time. But so first part of what you shared, Asta, that, and actually from what I had said previously, that there is a time where you can work on the maladaptive anxiety yourself. You can actually help build your own coping mechanisms, and you can get out from that phase and rebuild it back to a place of just use stress and not distress. And then there is a time where you need professional help, where that kind of self help may not be enough. So there are certain ways to identify that, certain things which you can put into your daily routine, which will help you to identify that at what stage of seeking help am I actually. So one thing can be very simple, which is a daily journaling. It's a very very therapeutic tool as well, and it is also helpful for your own self to gauge your thoughts. So whenever you are having certain negative thoughts, you should open up a diary, you make a diary, right? And you mention the time at which you had that thought, or probably the hours during which you had more number of those thoughts. You mention the exact thoughts which you are having. It may be I'm not good enough, it may be I'm a failure, catastrophic thoughts, those big statements which you are coming across. And you also mention what emotion you are experiencing when you had that thought. It might be pretty obvious to hear what I am saying. Obviously, if I'm thinking that I'm not good enough, I'll be sad or frustrated. But it is very important to document it. I'll tell you why later on. So you can mention that thought. You can make a column of the time. You make a column of the thought. You make a column of the emotion, that I had a thought that I'm a failure, and the emotion. For some, it might be frustration. For some, it might be sadness. For some, it might be disappointed. These are different words, right? But they may be on the same spectrum, but they are different words, and they are different expressions, and they are different emotions. That will help you to identify that how severe they are, and that will help to actually the person who will want to help you later on to identify that how much the severity is. Maybe somebody, while experiencing a negative thought, may actually jump to the thought of self harm, and for somebody it might be that the negative thought triggered a reaction where they said, okay, I'll study more to actually achieve what I want. So you mention the thought, you mention the emotion, and if that is causing a certain behavior, you mention the behavior. For somebody it might be I closed the books and I started crying. For somebody it might be that no, I told myself I need to study more to actually get to the place I want to be, and these thoughts are these thoughts are not fine with me. And for some, it might be just total avoidance, that I stopped doing anything at all. So you mention the thought, you mention the emotion, and you mention the behavior which you are experiencing. And you just maintain it, maybe for 2-3 weeks during that phase where you don't know how severe your situation is. During that time, after 3 weeks or 2 weeks or 4 weeks, you just look back at what is happening. And if you feel it is happening every day, if you feel it is happening multiple times a day, or maybe 3-4 times a week, it is happening frequently, and it is changing you as a person, it is taking away the happiness of your life, it is taking away the peace of your life, then it means you need serious help. You need a professional help. Then it means that at your own level, you might feel that it is difficult to navigate it independently. Because, okay, maybe independently you may be able to get through it, but at that point of time, professional help in the form of therapy, in the form of visiting a psychiatrist, maybe online, offline, howsoever you like, will aid the process of identifying the problem, of somebody working on the problem with you, and you also working on that problem yourself. So it will never be that a third person will be able to do it independently, as a psychologist or a psychiatrist be able to take you out of that particular situation. You eventually have to do it your own self at a certain level. But when the severity is more, it becomes very helpless for yourself. And then your effort may be 10%, maybe 2%, but it has to be there, maybe 1%. 99% is the effort of maybe taking medications or taking therapy. But as you come out of that situation, it will be your effort which will be the most pivotal component. So if you are in that situation, documenting your thought process is something which will help you to identify that problem there and then. So this is first part of what Astha had talked about. And then came the second part, I think, where she mentioned about uh, all these thoughts which come across us during a part of our competitive journey. And again, as I mentioned before, these thoughts, till a certain extent, may be important, maybe important to propel us, to push us, to make us work through the challenges. But after a certain point of time, these thoughts, if they are not helping us any longer, then it means that it is taking us to a place where uh, the overwhelmingness of the thought is now not compensating the time which we are wasting, or the kind of harm which we are doing to our own self. So uh, that will need certain kind of help, maybe through a guide, through a mentee, through a helper. Maybe it might be your good friend, not necessarily on a platform, maybe a friend, but if you don't have that kind of support near you, then maybe somebody like a mentor, maybe professionally or medically like a psychiatrist or a psychologist. So that need of help is very important at every point, because as soon as that intervention will come into your life, everything will change. It is personalized for everyone. Somebody might have a problem associated with, I'm not able to focus on the books, or after some time I'm getting distracted. For somebody it might be negative thoughts, for somebody it might be that the anxiety is overwhelming and it is not helping me to study. So it might be different. So every case will have to be evaluated independently to help them. But if you are identifying it, that is the first step of the journey.
Agreed on that part. So first of all, the exam or the career related challenge for most of us we encounter is just very self-made and temporary. And understand that you might have that feeling right now, but those who have scored really well this year NEET PG, they are also still going through this feeling that what after this? I'm still feeling that vacant inside me. So right now you might be feeling that the success will make cure everything, or this is the problem, that's the problem. That problem has nothing to do with the exam. That problem has more to do with your mindset, the way you see yourself, the way you perceive yourself, the way you value yourself, the way you have managed your life altogether. And having some discipline in life really help, and positive self-talk will always take you ahead in your life. So having like a to-do list, how I want to spend my life, spend my day with, how having a journal daily, like writing just a gratitude journal, or how your day went, any kind of journaling, having a hobby outside your work will really help you. Like it will build your impression in front of you, so that you will say end of the day that I'm very proud of myself. And the time you'll start having this positive self-talk, the problem will solve for many of you. Because this the problem which many of you have expressed, it's mostly with the NEET PG. It's mostly with the next exam I have to write, next career step I have to take. But you all are way beyond that. And if somebody is genuinely going through some problem and need help, you should definitely take a help. But for most of you, start encountering and encouraging that whether that problem need a help or it need a mental tweaking of your own. थोड़ा सा strict और discipline तो होना ही पड़ेगा, because even the gym workout we have to do, we have to be disciplined there and put the weights. Us time pe you have to go through that pain of lifting the weight. Similarly, for your mind also, you have to lift the weight. You have to do it in a right way. Uh, Karthik, your take on how you have handled it, how you have journaled your life to help your life, was your coping mechanism. You're on mute.
Yeah, cool. So am I audible now?
Yes.
Yeah. Cool.
Sapna and Arsha, your question will pick just after this. Okay? Then you can unmute
Yeah.
and ask.
I mean, like most of it have been already covered. So I guess, like I'll do it point wise. First was journaling only. I used to like how I started off was when I left off my seat. It was a very gloomy moment because everyone was saying that you left a seat and everything. I left MD Pediatrics. So that time, what I started was on daily basis, whatever used to come to my mind between like 9 p.m. to 10 p.m. I just used to sit with my thoughts and used to write them. Whatever I'd scribble, will it make either it makes sense or not? It does not matter, but it should just be like out there. It should not be within you. First thing. Second thing was you should be having a hobby. Like it is very much necessary to have a hobby. It can be as simple as a morning walk, or you can do like I used to read novels actually. So I finished 3 novels during my preparation also. So yeah, that was there. Third thing was so these thoughts used to come to my mind. What I used to do was actually like someone told me to do this. I just used to write it down. Like suppose मुझे सुबह 12 बजे some thought is coming to my mind. I'll just write it down in a line or so. Then at between 9 p.m. to 10 p.m., then I'll address it. Matlab, I used to keep separate time slots to, address those things so that it does not, I mean, it used to solve two purposes. First was it should not feel like I'm not addressing a part of myself which needs attention. And secondly, I am not like, disturbing the flow of my studies and everything. Then was planning. Then was planning. Planning have been the most important part of my preparation since I dropped. Because during my internship, I used to study according to my duties. But after my internship got over, I used to plan my entire day, like how much time I need to give to studies. Like when I want to wake up, when I'll sleep, it also like kind of maintained my circadian rhythm as well. My sleep cycle was very well maintained. Yeah, I mean, pretty much that's all. Yeah, these 4 5 points were the main things.
Arshia, you can just unmute and ask your question. There is an unmute button on the bottom. It just look like microphone. Or if you have put it here. So the question she's asking is that how to be focused in exam 3 hours, not to think of result and focus on each question with same attention. Anyone, Giteshwar, Karthik, like how to tackle and how to build this habit of focus, like how we should take our questions which our mind throws on us on check and keep focusing on what we are doing.
See, this is a very important question to address because this actually has something to do with the background noise of our life. Whenever we are doing a particular task, we have to put our full attention towards that task. So all lobes of our brain can actually function towards the success of that task. And if we are having a background noise, which might be in the form of worry, stress, anxiety, maybe physical sweating हो रही है, palpitations हो रही है, maybe psychological thoughts are in. So any background noise will not let us focus 100% on that goal. It might be an exam, and it might be just driving a car. If I'm driving a car and I'm worrying about the fact that I may not, barge my car into another car, so that worry will prevent me from driving the car properly. I'll feel insecure. I'll not be able to drive. I'll not be able to accelerate because I'm constantly worried and I'm fearing the eventual outcome, right? So that is something which I have personally seen and personally advised also. It is a little difficult and challenging to do, but you have to take the result out of the equation. That is something which, if you can do, that is a very good way to deal with the problem. When you take the result out of the equation while you're doing it, for example, if you're driving and you tell to yourself that what has to happen will happen, but if I keep on thinking about maybe the car getting hit into some other car, it will not help me any longer. I have to stop thinking about the eventual outcome and I have to just focus that how well I am driving in the next patch of 100 meters. So similarly, when I'm giving an exam, I have to tell to myself whatever the result may be, it may be, but the point is that if I'm doing this question wrong, it will eventually not help me in the longer run. So I have to cognitively restructure myself. And how to do it? You're also solving Q banks, right? Now I'll give you an example to actually put it to use because ये तो एक बड़ा example है. Now application based example. So you're doing Q banks, right? So when you're doing those Q banks, try to solve set of 15 questions or 10 questions, a string of questions. And while solving those questions, you have to put the impetus on individual question. And at that point of time also, that fear might come कि ये 10 questions के बाद अगर मेरे 9 गलत हुए तो फिर क्या होगा? But you at that point of time, you have to tell yourself, no, I'm going to focus on this one. This is the question. This is the most important question. If I keep on thinking, it is not going to help me any longer. So one question at a time. Start from your Q banks. Start from your small set of questions, 15 questions, 10, 20 questions, 10 questions, and try to make a habit of reading that question in your mind because mind can only process, a limited number of stimuli. So if you're passively reading, okay, there's a question written on the screen or maybe in front of me on a book, and I'm just passively reading it. So again, my mind can interfere by putting up a background noise. But if I'm like maybe lip reading it, so there's a question, what is the most common type of something, something, and I'm lip reading, what is the most common type? At that point of time, I'm compelling my mind to focus on that question because when I'm reading it, I have to, hear it out in my brain. So focusing on the present question which I am attempting will help me with the eventual outcome. So you have to practice it from smaller question banks, from smaller Q bank, smaller mock test, and then apply that in the 3 hour, the eventual mock test which you are going to give. So start from a smaller goal and then generalize that habit into the larger mock test. Directly actually telling you to, change it, do it in a different way, that might not be the right approach. You have to start by doing it from a smaller portion and then moving it towards a bigger portion.
Very well said. Even me also, when I have a lot on my plate, this keep on coming that this is just kind of mental distraction which comes into the plate, and this one minute. This happened because we always have 5 things to look up to. So when I'm doing something, there's another 5 things coming in my mind, which Giteshwar said that the outside noise. So how I have built this habit is that when I started, I was in a very bad state. But how I did, I always say myself one thing at a time, one thing at a time. When the thought came that the task 2 or task 3 is left, I told myself, yeah, I'll go back to them. Let me just give 5 more minutes to this task, and then I'll go to the task 2. And 5 minutes, 5 minutes, 5 minutes, and that ended up happening for 1 hour, 2 hour, and I was able to focus. And at the same time, I was very much, I'll say positive with me, encouraging myself. कि अगर मैंने आज 5 minute भी किया, I should say myself, I'm very proud of you. You have done a 5 minute of focused hour, and then that 5 minutes gradually become a Pomodoro of 30 minutes, 40 minutes. So always be very happy for your progress. Always be, because you are watching your growth. So start with a small focused hour of your MCQ. Start with 10 focused MCQ. Don't think about ki exam mein you have to sit for 3 hours. If this is your weakness, that you are not able to focus and thinking far-fetched of the result or the another task, start small with 5 questions, 10 questions. Be very positive and appreciate yourself for a focused 5 question or 10 question, and then move ahead to the next. Karthik, do you want to add in this? Mute.
Yeah. So what I did was I used to when I used to wake up, so we have our exam in sets, right? A set of 45 or 50 questions. So I used to set a custom module of 50 questions every day. Since last 5-6 months, I used to solve it every day, irrespective of the score that I'm getting. And my aim used to be was I have to be mindful. Like whatever I'm doing right now, I should be present in there. Then the next thing is, Dr. Ramisa told during one of his sessions that it's best to use your cursor also. Like whenever you are reading a question, you have to read it word by word. I mean, you don't have to run through it, just read it word by word. So that also helps. Plus, eventually you have to develop a habit of solving questions. That one. So can I ask a few questions out of the ones which were sent by the students from Sir Gideshwar? So yeah, there was one question which I found pretty fascinating. It says that I'm constantly struggling with anxiety in high stress situations like emergency duties. I'm having a lot of self-doubt regarding my career choice. What would your suggestion be?
I went through the questions as well, and I discussed this with Astha as well, that I really felt that certain questions are very individual oriented.
Okay.
So when we do assessment with regards to psychiatric assessments, we have to take into account biopsychosocial factors of the person who is putting across those questions. What kind of family history do they have, personal history do they have, what kind of environment do they work in, what kind of psychosocial factors we have to take into account. So it's a very broad question to be answered on this forum.
Yeah.
I think it's a very broad question because we have to understand from the person's perspective who's asking it the kind of situation that they're facing, because it might be just a maladaptive stress which is totally within normal limits and an exaggerated reaction, but it may be a full-blown disorder. So it can be anything. From those words itself, it is a little difficult to gauge the severity. It is more important to sit across with that person, know everything in detail, and then comment what we can do for that particular situation. For example, if someone was asking me that I have a problem facing high stress situations, and this is a very general question, not related with the second part of the question which has been asked, then probably I can be able to give a very generalized advice, which again will be something which is closely related to which is something which is closely related to something which I said in the previous question. was that in psychology, in psychotherapy per se, we work on something which is known as systematic desensitization and exposure and response prevention. The basic fundamental of those approaches is that we have to sensitize ourselves to that situation at a certain level where the fear of the outcome of the situation gets totally detached from us doing something. Because 90% of the times it is the fear that now the stress has set in. Now, if I take a certain step, everything will go wrong. Or if I don't take a certain step a certain way, everything will go wrong. And that fear, again, it's very, very related to the last question. That fear messes up everything, right? So for that person, it is important to sit across with that person, understand the variables of their personality, and curate a very personalized plan for them wherein they can break that cycle.
Kiteshwar, there is one very important question Ray asked, is that because of constant failure, we make a self-image that I'm not good enough or I have
Correct.
this limitation, blah, blah, blah. How to change that self-image or self-belief? Like what 2 or 3 actionable items we can take to change the self-belief?
Sure, definitely. First of all, the question in itself gives a clue. Constant failure. Definition of constant failure, it is very subjective. Somebody who has been, relatively more successful in their academic life may not do well enough in a couple of tests, which not again would not tantamount to failure, but which may just be not getting the kind of marks which they would want to. They would otherwise get 98%. Now they've got 83, 82, maybe 78 in a couple of tests, which can be because of an n number of variables. Now for them, maybe after 3, 4 of such attempts, they feel that I have become a failure. Catastrophization in itself, because again their own personal factors are such that it is compelling their mind to think that because I'm not doing as well as I've always done, I'm pushing myself to become a failure. So one actionable item is actually to understand that it's good to take accountability of your actions, but it is very important to be a third person. So we actually call it role playing. So you do your own role playing. You become your friend. You become your best friend. And you think to your thoughts as if you are not who you are, but you are a friend who you've just called up and you are sharing your situation with. And now you have to counsel that friend. You understand? Basically, I'm having certain thoughts. I'm having a thought I'm a failure, I've messed up my tests, and now constantly I'm having those thoughts. You have to do a role playing with your own self. Be a third person, look at your thoughts from a third person's perspective, and question your thoughts. That, okay, you're saying this, but it doesn't make sense because, from 2 weeks, you were very tired, you were drained out from your duties, you could not revise those books enough as much as you would have revised 2 weeks back. So it's okay. You had a little blip. It's perfectly fine. You can work on it another couple of weeks and your marks will again improve, right? So that role playing is something which is very important. Another actionable thing which we can do is known as mastery and pleasure. So mastery and pleasure means that because we're talking about medical students and we're talking about preparation of an exam, so I would want to keep my examples per se, but this is actually generalizable to every situation in life. So mastery and pleasure means that there are certain things which give me pleasure and there are certain things I feel I'm a master at, right? So now let's say I have come to that mode where I'm feeling that every MCQ that I'm attempting is getting wrong, all those tests I'm messing up. To just give yourself a positive confidence, like Astha had mentioned, positive self-talk. Positive self-talk works well in a social situation or in a situation where we are relating general thoughts. But in the context of academics, one positive method is known as mastery and pleasure, where you go and focus on solving the MCQs of the subject where you feel you are good at. You are good. You're anyway going to get good marks in that subject, but do it. Because when you do those MCQs, it will give you confidence that, okay, I have mastered this subject. And as I have mastered this subject or I have mastered this module, I can master other modules as well. I'm getting the questions correct. I am capable of getting the questions correct. I have the ability of getting the questions correct. And I'm showing it to myself. that I am getting it correct. So that is known as mastery over a subject or a mastery over a certain domain, and then get that giving you pleasure. So you're deliberately doing it to tell yourself that I am good enough and I'm capable enough. And then you can move to the more difficult domains, the more challenging domains, and you can actually alternate them with the domains which are a little easy, so that you are getting that positive boost in between. Okay, I mean, these are different tricks which we employ to actually remind ourselves of our abilities. There's a very beautiful story which, with what I would like to conclude it. So we all know the Ramayana. So Hanumanji had amazing capabilities. He was blessed with amazing capabilities, but उनको श्राप मिला था और उसके बाद वो अपनी इन कैपेबिलिटीज को भूल गए थे. सो जाम्बवन आए और जाम्बवन ने हनुमान जी को रिमाइंड कराया कि हनुमान, यू आर केपेबल ऑफ डूइंग सो मेनी थिंग्स, just remember what you know, what you can do, what you are capable of. And Hanumanji had those abilities inside him. And just that gentle nudge, that gentle reminder helped him to recoup, remember his abilities, and again develop those abilities. So that is life. We have it all in ourselves, but we have to remind ourselves. Sometimes we have to become our own Jambavan and remind ourselves through all these methods which we've talked about that we are very much capable of achieving greater heights.
Very beautifully said. So, Geeteshwar has to go. So, usse pehle, Sapna, you can ask her question and then we'll sum up the session. He had another meeting to go for after this. Sapna,
Thank you, ma'am. Yeah.
yes.
Thank you, ma'am.
Yeah.
Giteshwar sir, last year I'm a repeater. I'm doing this NEET PG entrance exams for last 3 years now, including my internship attempt. So, sir, last year when I started with my preparation, my mother fell ill. So for 3.5 months, I was like not able to prepare well. Once she recouped, 3-4 months I was studying really well. I was into the competition, but suddenly what happened is my father met with a serious medical issues and he had to be hospitalized and everything. So just near the exams, I was not able to study. On the day of 2 days before the exam, he underwent an operation, and in all that chaos also, I just managed to go and give the exam. So, sir, I managed to get an average score. So now that my parents, because I'm a repeater, my parents are telling me that whatever I have got the score, I should take up whatever I'm getting. But I'm getting a non-clinical branch in this score. And I really wanted to do some good clinical. I have a clinical orientation since beginning, and I know that if I take up non-clinical, I will end up leaving it within few months. I told this to my parents, but with all that, they are telling me not to continue because the competition is very high and all that. So, sir, even if I try my level best, that fear whether if I start studying again, I want to study. I want to study because I want to get that clinical seat. But with that fear, sir, I'm feeling like, what if my parents, they are senior citizens? What if again same thing happens? If they again fell ill, and again if I'm not able to score, how will I show my face to my parents? How will I keep up to my words that I will do it this time? So, sir, how to cope up with those negative feelings, sir?
First of all, Sapna, I really want to say that you're very brave and your parents would be proud of you that you were supporting them through this situation that they had went through, and the last 1 year has been really tough for you, and despite everything you've been able to achieve a rank where you're saying that you're getting a post graduation. Post, definitely it's something, maybe the kind of seat which you did not want, but you are getting something. So this means that it has translated into certain kind of a result and you've been able to manage it at a certain level, albeit not the kind of result which you would have wanted in another scenario. So coming to your particular question, see, I really believe that uh, we need to understand the rational elements and the irrational elements of what we are thinking, right? So you have what you have mentioned. There are certain elements which are more rational, certain elements which are irrational, and they are irrational because they may or may not be true, but they are valid because they are stemming from an anxiety which you have had because of a traumatic last year. So first we need to divide those elements, unwind them, unmesh them, and look at it from a logical perspective. If so, first thing, would I want to drop or not in this situation? And second thing is, would or not my parents, have such a bad time again? Those are two very different things. Now, when we mix those things, definitely we think of life comprehensively. When we mix those things, then it creates a problem. But we have to independently evaluate those two situations so that we can come to a rational answer. So, first situation is, do I want to drop or do I want to give another attempt? So, as you have mentioned in the question itself, that I want to give a shot because I believe I can do more and I want to get a clinical seat. So, you are actually clear in yourself with the kind of decision that you want to make. And very evidently, as you said, that your parents believe that you should pick up a seat and not waste any more time. Now, see, the chances of something which is out of our control going wrong or right are in any case not in our situation. But the chances of you improving your rank or getting the kind of seat you want after putting in the kind of hard work you can are still very much in your control. So the controllability of those two situations, one is totally out of your control and one is relatively in your control. Again, I would say relatively because there are third variables which are totally out of our control in every exam, but relatively it is in very much in your control where you can work on it. So if you feel that, your parents will be convinced with some reasoning which you can put across that you really believe that you can do better, and you just actually deviate yourself from that irrational negative thought which is coming repetitively in your brain that, okay, what if something happens to them, because as I've mentioned in multiple contexts before also, there are unseen variables. Tomorrow anything can happen. Tomorrow, maybe the kind of exam you're thinking it'll happen next month, it may be delayed 3 months ahead. COVID pandemic came, the exam was delayed 1.5 years. These are all confounding variables which are out of our control in life. If the situation comes, God forbid the situation should not come, but if the situation comes, then it will have to be tackled there and then. But right now, it is not, foreseeable. God willing, your parents will stay healthy. But God forbid if that comes, it will have to be dealt there and then. So you will have to be little brave with your decision making process, and you will have to stick with the controllable variables, wherein the controllable variable is that the exam is definitely happening again. The controllable variable is that you are definitely capable enough of working towards the exam again, and you are definitely wanting to improve your rank and wanting to get a different seat. So these controllable variables for me, from just the question which you have asked, because again, it's not a detailed one-to-one session where I understand all the variables. There might be some other variables also which are playing along. But if you are convinced that you want to do it and you can do it and you are sure about it, then it is definitely giving worth a try. And you have to constantly remind yourself there and then that the uncontrollable variables are anyway not, going to change. That is what has to happen, has to happen. And if nothing has to happen, nothing has to happen. That is only happening in our mind because we have become anxious from our own experiences in the last 1 year. That has put pressure on our mind, that has made us more anxious, but that is not in our control. So you have to work on the controllable variables. That is what I have to say on that.
Thank you so much, sir. It
Agreed.
was really, really nice. Thank you so much. Thank you,
And
Darshita ma'am.
Sapna, whenever
And the-
Sapna, whenever we have a choice to think, I know even in the lot of negative thoughts, just ask yourself that what if it works out? Because I keep saying this to myself rather than just thinking कि नहीं हुआ तो क्या होगा? But
Hmm,
अगर हो गया तो क्या होगा?
absolutely. Yeah. Yeah, ma'am.
So
Definitely.
just changing your but will change a lot.
Yes, ma'am.
So chalo, I will sum it up. I will close this because Geeteshwar have to go. So thank you all for joining in. Thank you, Geeteshwar, for taking this wonderful session. Karthik and Riddhi for sharing their experience. If any one of you, because couple of things, because of compliance and the personal thing when it's come to the personal stories, we are not discussing very detailed. So if any one of you want to share their personal story, talk and get that personal help, Geeteshwar, Karthik, Riddhi, all of them are available on Salah platform. You can have your one-on-one session with them. So, and they are more than happy to help you out. They are there cheering for you. So thank you for joining in. And happy Dhanteras and very advanced happy Diwali.
Thank you so much, Giteshwar sir. It was really, I got such beautiful insight, not only for this situation, maybe in life also. Such dilemmas tend to occur repeatedly, maybe with some other problems. So I will always remember your advices. And Darshika ma'am, you are the path setter for all of us. Of course, you are the light taking us forward. Thank you so much. I wish you a very happy Diwali to everybody here. Thank you so much.
Thank you all. Bye, good night.
Bye, good night.
एंड पढ़ाई छोड़ के थोड़ी घर की सफाई भी कर लो, सब मम्मा गुस्सा करेंगी, वैसे भी दिवाली है. चलो बाय.